When the coronavirus first arrived in the United States, few places were hit as hard as nursing homes, and few nursing homes were hit as hard as the Menlo Park Veterans Memorial Home in central New Jersey. A Wall Street Journal investigation found that nearly 100 people died at Menlo in April, more than 10 times the number in a typical month. A spokesman for the state agency that runs Menlo declined to respond to most of the journal's questions, citing expected litigation. But in August, reporter Chris Weaver interviewed Vietnam veteran and surviving resident Glenn Osborne to understand more about what happened to the residents of Menlo Park.
Now that we're nearly 6 months out from the beginnings of the pandemic, do you feel like you know the status of all the residents who you knew before the outbreak began?
I would say 85% I know. There's a few I don't know, and I would like to know of a couple residents that I knew socially, where they are. Recently, even though I'm not supposed to wander out, I've gone out and I would find them. They're so weak, they can hardly talk, and they're so pale, and they're not moving, and they're still trying to recover from this disease. It's a horrible thing to see.
Among the dead were 84-year-old Isabella Kovacs and 86-year-old Joan Williams. Their stories provide a window into what went wrong at Menlo Park. The Menlo Park Memorial Veterans Home accepts veterans, their spouses, and Gold Star parents. It has 312 beds in 6 residential units, all with patriotic names: Stars and Stripes, where the dementia patients lived, and Freedom, where Joan lived. Joan moved to Menlo in 2015. She was elected to be representative to the resident council for about 3 years running.
She would travel up and down the hallway of Freedom, talking to the residents, asking what is their concerns. And that can go on for, a half hour at a time sometimes.
We would go to visit her, and even family members of other residents knew my mother on a first name basis. She always had her makeup together, her hair done, and, just a classy type of lady.
Isabella Kovacs arrived at Menlo Park in January 2020. She had served in both the Army and the Air Force. Like Joan, she was in the Freedom Unit.
Once we got here, they had a little room that with a big sign that said welcome on a chalkboard, and they had a balloon for her, and they brought us all beverages and offered us some lunch.
But she would have little time to settle in. Not long after Isabella arrived, there was an outbreak in the Life Care nursing home in Kirkland, Washington, and soon after, the coronavirus began spreading rapidly in nursing homes around the country. Still, Menlo was caught flat-footed by the outbreak, and the administration's best attempts to mitigate the spread fell short. They created a quarantine area for COVID patients within the Alzheimer's unit, Stars and Stripes. It was separated from the rest of the unit with a plastic tarp. And the home resisted other, more obvious safety measures.
One of the things that we keep hearing about is that the staff weren't wearing protective equipment all the time, and in fact that it sounds like the administration might have instructed them not to for some reason.
Yes, I actually witnessed senior administration physically remove the protective equipment from the storage cabinet. They were said, "We don't want you to wear it because you'll frighten the residents." And that frightened me more than anything.
Staff members claim they were not allowed to wear masks outside the quarantine unit. A March 27th email from the New Jersey Department of Veterans Affairs to Menlo's CEO outlined the escalating consequences for mask insubordination: oral counseling, written warning, official reprimand, and suspension. The Menlo spokesman declined to comment, but Brigadier General Mark Petirsky, who was deputy director of the agency at the time but has since retired, said masks were in short supply, and the agency was following federal guidelines. Joan and Isabella's story takes a turn in the end of March.
I spoke to her on a regular basis. I spoke to the nurse supervisor. She was doing fine.
On March 30th, Menlo resident Rose Denty tested positive for the virus at an emergency room at a nearby hospital. She died the next day. The virus was inside Menlo Park, but the administration didn't tell residents' families.
April 3rd is when I lost communication with my mom. The 4th, still can't get in touch with mom. The 5th, can't get in touch with the nurses station, can't get in touch with mom.
Joan was somewhere on the Freedom Unit. A few days after Shari lost track of her, she was put into room 239 alongside Isabella Kovacs.
It was obvious by then Joan was very sick. She was asleep all the time, and they were in there checking her temperature all day long. She said, the staff wouldn't tell me anything.
But in an April 6th email, the home CEO, Elizabeth Schiff-Heedles, asked for permission to tell residents and their family members that COVID was spreading. The next day, April 7th, she mailed that letter, but more than a week after the first resident tested positive for coronavirus. But it was too late for Joan. She was transferred to room 753 in Stars and Stripes, and later that night to the hospital.
Mom tested positive for COVID. Her lungs were in very bad condition, so it was like a perfect storm.
Back at Menlo, Isabella was getting sick. She too was transferred somewhere in Stars and Stripes.
I asked 3 different staff members if they were going to test her for COVID, and all 3 said, we don't test for COVID here.
On April 12th, well into the outbreak at Menlo, the New Jersey Department of Military and Veterans Affairs posted this video on Facebook. It shows the staff and CEO of the home, Schiff-Heedles, dancing in the hallways in an apparent effort to raise the residents' spirits. Menlo declined to comment.
They trying to say they're trying to cheer us up. I was in shock. They were dancing in the hallways where literally the residents were dying in the rooms that they were passing by.
The plastic sheet separating Stars and Stripes from the rest of the facility was sagging. Staff members in full PPE went back and forth across the partition. More and more residents were being shuffled throughout the home. Isabella was sent to the emergency room on April 17th and also tested positive for COVID. She and Joan were dying.
They let me gown up. I put on 2 masks and a face shield. I had 2 pairs of gloves. I told her about heaven, and I listed the names of everybody she's going to see again. I told her that she was the best mother I ever could have had and how much I loved her, and that she's going to get this mask off and she's going to fly free. And I couldn't stay in there that long because I didn't want her to just hear me cry. I was just crying a lot, so.
And then the nurse knocked on the door, and I told her, I said, Mom, I love you. And that's the last that I was with my mother.
Unfortunately, both passed away within a couple of days of one another. I wanted to, share those details with you only because it does seem like, her particular path kind of covers some of the same ground that we were speaking about generally earlier.
It means a lot to me. I appreciate it. Thank you.
Joan Williams died on April 21st. Isabella Kovacs died on April 23rd. Their families are among those that have begun the process of suing the agency that runs Menlo. The agency reported just 62 deaths in its official tally. A spokesman said that count is based on experts' conclusions and that the agency mourns the loss of every veteran at its facilities. But dozens more died with COVID-like symptoms, according to internal patient records. Many of those residents were never tested, their families say. The New Jersey Department of Health ultimately confirmed the journal's findings, revealing another 39 probable COVID deaths at Menlo.
I have lost more friends, more good veterans than I did in the war and combat. These are true heroes. That they fought for America. They were wounded soldiers and came back from World War II and Korea and Vietnam, only to be left here and treated with indignity and not cared for, not protected.